People are often told the possible complications that can occur after surgery, but whether you know what to actually look for is another question altogether. And while in cases of ACL reconstruction, you will typically have a physical therapist monitoring your progress and keeping an eye out for any issues with your recovery, it is also good to know what to look out for yourself, because there are a number of complications that can pop up after surgery that can negatively impact your outcomes and slow your rehab. And being aware of these complications will help you be more engaged in your own recovery process. So in this video, we will explore 4 complications that you should be aware of following an ACL reconstruction, starting with the least common and working some of the most common complications. Number 1, septic arthritis. An infection following ACL reconstruction surgery is a rare event, occurring in less than 1% of all cases. Infections are a result of contamination when the graft is being handled in the operating room. An interesting reason for graft contamination that I stumbled on when researching for this video was, I quote, graft falling on the floor. I guess the surgeon didn't use the 5-second rule in that case. Infections typically present with pain, swelling, redness, and an elevated white blood cell count that presents within the first 2 weeks after surgery. The diagnosis of infection is confirmed through joint aspiration, where they take out fluid within the knee and test it for bacteria with cultures. Management includes immediate arthroscopic irrigation and debridement, where the surgeon goes in and cleans out the infection, combined with a course of antibiotics for 6 weeks. Graft reconstruction may be required in cases where the graft is damaged. Number 2, graft failure. Graft failure in ACL surgeries happens in approximately 5% of cases, but most cases of graft failure are related to issues with positioning of the femoral tunnel. This is where the tunnel drilled by the surgeon is in the wrong position, usually too vertical, too anterior, or a combination of the two. The malpositioning of the femoral tunnel can lead to persistent knee instability and a reduction in range of motion for knee flexion and extension due to graft tightness. In these cases, a revision reconstruction becomes necessary, which involves creation of an entirely new femoral tunnel. Number 3, arthrofibrosis. Arthrofibrosis is a condition characterized by abnormal increase in formation of scar tissue within a joint, resulting in stiffness. This condition frequently emerges as one of the most common complications following ACL surgery, affecting approximately 5 to 38% of individuals who undergo ACL reconstructions. The telltale signs of arthrofibrosis become apparent during the earlier stages of rehab. You may experience an inability to fully straighten your knee within the first 2 weeks post-surgery, or struggle to bend your knee after about 6 weeks after surgery. The severity of arthrofibrosis can vary, ranging from mild limitations in joint mobility to severe stiffness. There are several factors that can predispose individuals to arthrofibrosis. These include undergoing ACL surgery within the first 4 weeks after the initial injury, having multiple ligament injuries, or entering surgery with residual knee swelling, or before regaining full knee mobility. MRI can be used to confirm fibrous tissue buildup, which may surround the ACL graft and extend into the infrapatellar fat pad, suprapatellar bursa, or posteriorly in the posterior joint capsule. Early post-operative knee mobility plays a key role in preventing arthrofibrosis. If mobility cannot be restored through conservative rehab, surgical intervention may become necessary. This procedure involves a surgeon re-entering the knee joint to remove excessive scar tissue. In some cases, a manipulation under anesthesia may also be performed, where the surgeon forcefully manipulates the knee to break up the adhesions. Yeah, not a fun thing to go through, but luckily you would be knocked out for this. Number 4, Cyclops lesion. Cyclops lesions are thought to be the most common complication with ACL reconstructions, occurring in roughly 25% to 47% of individuals. 2 to 10% of these individuals are clinically symptomatic, meaning the obstruction impacts mobility and function. A Cyclops lesion is a fibrous nodule that develops along the front of the ACL graft. One of the hallmark signs of symptomatic Cyclops lesions includes loss of the ability to straighten the knee, as well as painful snapping or catching sensations. You may also experience a deep nagging pain when attempting to extend your knee along the central part of the joint. Unlike the other complications we've discussed, the development of symptomatic Cyclops lesions are more likely to happen later in the recovery process, usually around 6 weeks, but can even develop months after surgery. When there's suspicion of Cyclops lesion, MRI can be useful to confirm its presence and determine its size. In cases where the Cyclops lesion is symptomatic, impeding knee mobility and your ability to engage in physical activities, surgical debridement may become necessary. During this procedure, the surgeon removes the accumulated tissue that is obstructing the knee's mobility. Another procedure known as notchplasty can also be utilized. This is where the surgeon widens and reshapes the intercondylar notch to avoid impingement of the graft when the knee extends. Want to know more about Cyclops lesions or other keys to ACL rehab? Well, check out these videos. And while you're at it, give this video a like to help it spread to more people and help the channel grow.